Module 2, Responding to Seizures. In this module, we'll look at the recognition of main seizure types and the appropriate first aid response for seizures. Now, there are many different types of seizures, over 40 in fact, and what is experienced by the individual during the seizure will depend very much on what type of seizure is occurring. Oftentimes, when someone refers to a seizure, we might imagine a person lying on the floor, shaking and convulsing uncontrollably. This is what is known as a tonic-clonic seizure. Again, it's important to state here that not all seizures are caused by epilepsy. And although they can look very, very similar, they could be caused, for example, by hypoglycemia, that's a low blood sugar level, cardiovascular problems, or as a result of extremely high temperatures that we call febrile convulsions in very young children. Now, being able to categorise an individual's type of seizure goes a long way to helping doctors and medical professionals prescribe the best treatment for that individual. In 2017, the International League Against Epilepsy, now that's a multinational group of leading epilepsy specialists, they developed a new classification system for seizures. This classification system groups seizures based on three main factors. Where they start in the brain, this is referred to as the onset. If the individual's awareness is affected, and if the seizure has other symptoms associated with it, such as movement. Through this classification, seizures are grouped into three main categories, which are focal onset, generalised onset, and unknown onset. You will see on the screen now this classification system showing the three categories of seizures along with their individual subcategories. So let's have a look at some of the more common seizure types in a little bit more depth. If we start with the focal onset seizures, this means that the seizure is only affecting just one part of the brain. Now, this seizure type can be subdivided into aware and impaired awareness. This is explaining what state the individual will be in. So with a focal aware seizure, the individual will remain conscious and be aware that something is happening. They will also usually remember the seizure occurring after the event is over. A focal onset impaired awareness seizure will affect a larger portion of the brain, but it is still restricted to one hemisphere. Now, during these type of seizures, the individual's levels of response will drop. They may remain conscious but unaware of changes in their surroundings and therefore may not react normal to external stimuli. It is common for the individual to be confused and disoriented during the post-ictal state. That's the technical name after the seizure has happened state. Focal aware seizures will affect an individual in a number of different ways, depending on exactly where within the brain the seizure starts. For example, those starting within the temporal lobe may include a rising feeling within the stomach, a sense of déjà vu, a strange taste or smell, or a sudden feeling of fear or joy. Frontal lobe seizures may present with twitching or numbness in the limbs, whilst occipital lobe seizures will most likely cause visual disturbances or hallucinations. For some people, focal awareness seizures are referred to as warnings or auras, as this type of seizure has the possibility of spreading to the second hemisphere of the brain to cause a generalised seizure, in what is referred to as focal to bilateral tonic-clonic seizures. Now, it's not uncommon with focal onset seizures to see the presence of what we call automatisms. Okay, that is involuntary or unconscious movements and actions such as lip smacking or pulling at clothes and skin. When you look at the EEG results of people whilst experiencing a seizure, you can see a marked difference between the brainwave patterns of those experiencing focal and generalised onset seizures compared to someone who isn't experiencing a seizure. As you can see on the picture in your screen now, the normal EEG reading shows the small fluctuations in brain activity that happen in all of us every day. During the focal or partial onset seizure, the rapid spiking of the brain waves is showing on just one hemisphere. With the generalised onset, not only do we see the excess electrical activity in both hemispheres here, but the pattern has changed again to give a cluster of spikes together called polyspikes, followed by a wave, before repeating this cycle. That whole cycle will probably occur about 3 times a second. Now, tonic and atonic seizures are both typically very brief seizures, and these are what we call generalised seizures. And they often happen with no warning. A tonic seizure will cause the individual's body to go tense and rigid, and that may cause them to fall, often backwards. Atonic seizures, which we sometimes call drop attacks, are the polar opposite of a tonic seizure, in that during atonic seizures, an individual's muscles relax and go floppy. This again is likely to cause the individual to fall, only this time it's more common that they fall forwards. As I said, both types of seizure tend to be brief, and people will usually recover very quickly. However, we must be prepared for secondary injuries that may have been caused by the fall. Now, absence seizures. Now, these are much more common amongst children than adults, and are typically very short, only lasting a few seconds. It results in the individual becoming unresponsive with a blank or vacant look on their face, or they may appear to be daydreaming. It is possible, though, during typical absence seizures, that an individual may continue to stand or even continue walking, though they will be unaware of what they are doing. Another form of seizure is what we call a myoclonic seizure. Now, these are quite a unique form of seizure, as whilst they are described as a generalised onset, the individual will remain conscious throughout and be aware. It's common for myoclonic seizure to be accompanied by other seizure types, such as a tonic-clonic. The word myoclonic literally means muscle jerks, and many of us will experience these myoclonic muscle jerks when falling asleep or very tired. That, of course, does not mean that we all have epilepsy. However, the presentation of myoclonic seizures does follow a similar pattern in that the triggering of them is often related to being tired or having just woken up. The final seizure type that we're going to look at in the generalised seizure category is the tonic-clonic seizure, the most common form of epileptic seizure, and in most cases the most dramatic to see, which has led to this form of seizure becoming synonymous with epilepsy. There are three distinct phases in the tonic-clonic seizure. During the tonic phase, an individual's muscles will contract, the body will stiffen, and the person is likely to fall to the ground as they become unconscious. During the clonic phase, they will experience a series of rhythmical jerks as muscles contract and relax. Breathing may become noisy and laboured, and the skin may become pale or even cyanosed. It may also be that they experience incontinence during this stage. In the postictal phase, once the convulsions have stopped, the individual will begin to regain consciousness, but will likely be disoriented, have no memory of the event, and probably be quite tired. The length of a seizure varies from person to person, but will typically last from a few seconds to a few minutes. Any seizure that continues for longer than 5 minutes, or where the individual begins to have subsequent seizures without regaining consciousness, is a medical emergency, and an ambulance should be called immediately. One of the most important things that we can learn about a person and their unique epilepsy is what causes or triggers the seizures. If we are aware of the common triggers, we can take steps to avoid or manage these situations. So I want you to take a few moments now and think about what is likely to trigger a seizure in a person. So what have you come up with? I would bet that somewhere near the top of your list, if not at the top, would be flashing, flickering, or strobe lighting. Would it surprise you to learn that less than 4% of people with epilepsy are triggered as a result of photosensitivity? Some of the common triggers for seizures are on your screen now, but the most likely events to trigger seizures include late or missed medication, a lack of sleep, and high levels of stress or excitement. We now need to think about how do we respond to these types of seizures. In most cases, our basic principles will be the same. Stay with the individual, guide them to safety or keep them safe by moving hazards out of the immediate area. Continue to reassure them and wait for the seizure to stop and for them to fully recover. In motor seizures, those that affect muscles and movements, we may need to think about cushioning and protecting the head to prevent or reduce the risk of head injury. If the individual remains unresponsive after the seizure, it is imperative that you manage the situation by following basic first aid principles to ensure that they have a clear airway and that they are breathing normally. If you haven't completed a first aid course, you'll find a link on the course dashboard to an instructional video on how to complete a primary survey on a casualty and place an unresponsive casualty who is breathing normally into the recovery position. And remember to always call an ambulance if an individual's seizure goes on for more than 5 minutes or whatever is usual for them. if they are unresponsive for more than 10 minutes following a seizure, they go into multiple seizures, or they become injured. This is the end of Module 2. Thanks for watching, and don't forget to watch the extra first aid videos and complete the knowledge checks before moving on to the next module.